thank you all for coming. As a matter of introduction, my name is Dr. Janet Kim. I am a med-peds trained physician, and I've been the chief medical officer at our health center since 2009. But I've been a part of the inception of the health center coming together, which has now been almost 20 years that the health center has been in existence. And had an opportunity given by CCHF to be able to share about our experience that we've had. I know you all have probably been hearing in the news of what's been happening with the migrant arrivals to New York City. For any of you who went to the talk that Matthew had given from Jericho Road, I think if you put my talk and his talk together, I think they complement each other really well. We never talked about our talk. We just kind of knew the titles, and that's just by the grace of God that it actually complements, I think, each other's talk. So if you were at his talk, consider mine like part two, continuing from what Matthew had talked about. My hope and my goal is that we're going to share our experience and our story. We're going to go back to when the migrants first started arriving now, about a year and a half ago. And I'm hoping that we'll have some time to actually have some interaction and discussion. My hope is that you will walk away from whatever ministry context that God has put you in, that there's something here that maybe could be helpful for you in your community, whether in your church or in your school or even in your workplace. I took a look at the list of people who are interested in attending, and I'm very much humble that I'm even doing this presentation because some of you may be working already in refugee health, and this is something that is new to us. So you will see that our experience is a little different, though if I maybe misspeak or misrepresent, please, it's more because we're new and appreciate the experience that's also in the room for those that have already been doing this for much longer than we have. In that key point. Okay, so just a little bit of background about Beacon. So we started in 2006. We were New York State's first Christian faith-based community health center. And eventually, we ended up being the first FQHC, which then came Jericho Road right afterwards. So we're very much in great company. And thankfully, we have other health centers that are not FQHCs. You may have heard of Koinonia in Albany, his branches in Rochester, New Life Community Health Center in Queens. So there's about 5 of us total in New York State. And by being community health center means that we are now authorized under the Department of Health to be in operations. And then being overtly faith-based in our identity is something that amongst the 5 of us is a unique category that we call ourselves in. So currently we're serving about 6,000 patients annually. We have about 18,000 visits. And we're in the northwest section of the island. I don't know if this mouse works. So for those, I did not grow up in New York. If my husband was here, he would tell you how I nearly massacred our relationship. Because you can see there's a very thin strip of blue that separates Staten Island from New Jersey. I kind of ignored it. So I thought this was a peninsula of Jersey, which if you tell that to anybody from Staten Island, that's a major, major insult. Anyway, so these are the 5 boroughs. And we are located in the northwest section of Staten Island. So we are on the farthest section of the city, farthest section, so we're closer to New Jersey. And we currently are providing a full spectrum of services where we do internal medicine, pediatrics, full OB-GYN, including prenatal care, podiatry, nutrition, behavioral health, and by God's grace, we're expanding into dental this year. We're still praying for an optometrist to be able to come our way. So that's where we are now. So as a matter of background, back in September of 2022, this is the first page of a 3 to 4 page memo the Department of Health commissioner sent out to providers to prepare us for what was about to come. So this was in September of 2022, and at that time, they were expecting Venezuelans, some Colombians, and Haitians. So the buses were just starting to come to arrive, and they gave us an outline of what to prepare for. Look for medical conditions, looking for communicable diseases, looking for TB screenings, looking for other infectious diseases, looking for measles and varicella, look for the mental health needs. For us, we also wanted to include our emotional health and spiritual health screenings and interventions. And we also have on our staff an insurance enroller, so we knew people would need help with getting on insurances. So when we received this memo in September, we got our own teams together and prepared for what we're going to see. We didn't know how many we were going to get. We just needed to be prepared. We've had undocumented individuals and families in our community as long as I remember. So this isn't really new for us. But we were actually ready with our team. And you probably all remember this this is the first tent shelter that was built, subsequently taken down, and then rebuilt again and where it is now in Randall's Island. This is the first initial pictures back in October 2022. I include this chart, even though it's not exactly accurate, but it does show you where we were back then. So the number of people living in homelessness was actually trending downwards. And this big spike that went up to about 62,000 is actually when the big influx started coming in. Now, as of yesterday, we are now up to 183,000 individuals that have passed through New York City. And as of this moment right now, there's about 65,000 that are still under the care of New York City. And the way that New York divided it up is they have the single adults, men and women residing in shelters throughout the city, and then families are in separate designated shelters throughout the city. It got very confusing very quickly because different agencies started getting involved. And as with any bureaucracy, certain people don't talk to one another. So we have Department of Homeless Services doing one thing. We have Department of Health with the Health and Hospitals Corporation that runs the city hospitals doing something. And then you end up having Office of Emergency Management doing something. They're all doing something, but they're all a little different. So where we were in the very beginning was working with our local community-based organization, which we know as Project Hospitality. They're known for being a strong homeless advocate as well as a servicer of the homeless. And so keep in mind, let me back up to where we were in September. We're getting ready, so we're not completely caught unawares. We kind of know what to expect. And then I get a phone call from the director of Project Hospitality. This is on a Wednesday in October. And she said, Janet, I'm sure you've heard in the news that there are buses arriving in Staten Island. I said, yeah, I've heard. She said, well, I have about 5 or 6 kids of the new arrivals that have come. And at that time, the protocol from the city was if anybody needs any medical attention, you just automatically call 911. No matter whether it's a cut to they're dying, it doesn't matter, you just call 911. The other thing that this director was hearing is that she was hearing stories of people flagging down cars just passing by, trying to get any help whatsoever. Because what I think happened is these buses arrived in the night, dropped them off, and left. There were people there trying to help get them settled, but that's all we got. There was no on-site medical care. There was even when we came there, about 2 or 3 days after the initial bus arrivals, it was still chaos and mayhem. So she called me because she knew me from past work that I had done. We were part of their COVID vaccination outreach to the homeless community. So we had done a lot of collaborative work with them in advance. And I believe because of that working relationship, she knew who we were. And she said, look, I just need you to go and see. I have a feeling these kids are just needing basic primary care. They just need to be assessed, like, do they have a cold? This is October. Cold and flu season was just starting. A lot of these families were coming from warmer climates. They weren't used to, it was about 50 degrees then. They weren't used to the colder weather relatively for them. And I said, okay, tell me how many it is, okay, and who am I asking for? And it was chaotic even when I went there. And I have a staff member with me, her name is Luisa. If you can raise or shake your hand. I grabbed her because my Spanish is un poquito, so I said, I need her to come with me. And I grabbed what I could. Grabbed a bottle of Motrin, because if kids have fevers, they're probably going to need medication. Grabbed a thermometer, which unfortunately stopped working the minute I got there, so I didn't quite do my good check there. Grabbed my stethoscope, and I had no idea what we were walking into. Just tried to mentally prepare. What am I seeing? And what struck me the most, my first impression when I walked in there, was I am meeting somebody, and I am not what they expected to see. And I was very sensitive to the fact that this is not what they were expecting to happen to them. And here I am coming to do something, but am I going to meet their expectation for what they're looking for? Also, I don't speak the language very well. I have no idea what ailments they've walked through. I have no idea where they've come from. All I know is that they all arrived overnight sometime by a bus. That's all I know. So what was supposed to be about 5 or 6 kids, we ended up seeing about 26 patients in about a 2.5-hour span, and we had to cut that just because we said we have to stop. A lot of, thank God, what we saw just needed education, reassurance, but once word went out that there was a medical person in the building, of course everybody started, spreading the word around. But for us at that time, it was more of an assessment trip. It was more of a triage trip. It's, what are we getting ourselves into? We had made no commitments. We just said, let's just assess what's going on. Is this just a one-time thing? Is there more that we need to do? So took this back to our medical team, took it back to our executive leadership, and just proceeded with the needs evaluation. So a couple things to note, which I will show you in some upcoming maps. The location of where they put the migrant families is in the most remote part of Staten Island that you could think of. There is no bodega nearby. There is no pharmacy nearby within walking distance. There's no grocery store nearby. Forget the fact that you don't even know where you are. If you walk outside of the hotel, you see a highway, and then the bus stop is a good 5-10 minute walk. That's all you have in this area. So we have an issue with the remoteness of the location. Access to medications, things like thermometers. How are they going to get any of that? We did have the support of New York City Department of Homeless Services, DHS. So they're providing shelter, they're providing prepackaged meals, but there's no medical care. And then there was an immediate need for getting kids into schools. This was a family shelter, so over 50% of the people living at the shelter are kids under the age of 18. I got there on a Wednesday. They already had staff from the Department of Education enrolling and registering these kids. By Friday, they were already in school. Most of them had never been to a doctor's office for a physical or for vaccines. So we're in this situation where we see the need. What are we going to do? Or what are we supposed to do? So as a matter of more further explanation, so the red dot is the location of the shelter. And I put the rest of the map of the city as a reference point so you can see it's all green around here. It really is it's actually very near the Fresh Kills landfill, which is where they processed all the materials from the World Trade Center. This was actually the city dump for many years. So again, it's in a very remote location. And as another reference point, and just as a geography, so this is Staten Island, this is New Jersey, Manhattan is up here, and then this is Brooklyn going into Queens, and then Bronx is further up here. As another comparison, in terms of access of services, when we mapped out where is the other medical services they could go to, we found out we're one of the closest, and closest is a 12-minute drive, I should say. It's about 3 to 4 miles, but there's no straight road to get to us. What I don't show you here is the public transportation map. If you were going to take a public bus to come to us, it's 50 minutes, 2 buses. So took this back to our staff and our team and said, I think we're the closest people. We got to try to do something. Thankfully, we had buy-in from administration and from our staff to support this. So this is just an outside picture of the hotel complex where you'll see There's actually 3 hotels that was in this space. The middle hotel, which you see is the Holiday Inn Express. That's what it used to be, was a Comfort Inn in the back. When we came, the Holiday Inn Express was the one hotel that they took over. Within a span of a week, they ended up taking over both hotels. So that ended up resulting in about, was it 90 rooms total between the 2 hotels? Okay. Okay, so there's yeah. And then in each room is a family unit. So you can have anywhere from 2 to 3 to up to 4 in each room. And there are some multi-generational families that have come, where there's grandparents or aunts and uncles with parents and with kids. So they immediately took over those 2 hotels within a span of weeks. So a few more things that we found out as we were researching the migrant population. We found that even though you did see some husbands and heads of households, male heads of households, most families that were coming were single moms with kids. And we found out that the men were staying down still in the federal shelters at the border, that they were being separated. Again, I mentioned that we had the multi-generational families. And in the first wave, we did have the majority were Spanish-speaking families. So just like what the city was warning us. Most from Venezuela and some from Colombia. As of now, that has changed, where now we have not only the Latin American and South American countries, but now we have Caribbean, Africa, the Middle East, and Russia. In this first wave was a family from Ghana. And I asked the father, I said, how did you get here? He's like, oh, we flew to Brazil with his 5-month pregnant wife and his 1.5-year-old. I said, okay, and where'd you go next? He's like, well, we started walking. And by the time he got to the 4th country, I don't know what to say. They crossed over through San Diego and then somehow ended up flying to New York. That's how they came into this hotel. But as I mentioned to you in the beginning, that each family came with their own set of expectations. And what we were trying to provide, what we thought was helpful, may not be what they were expecting. And that was something that I felt we had to walk very carefully, not to overpromise, but at the same time recognize that we may not meet your expectations, whatever they may be, because this was not the kind of journey you thought it was going to be like. I did have to block out the kid's face just for privacy reasons, but I took this picture because at the time when we did our first triage assessment, they put us in the fitness center because that was the only place that was not chaotic. The blessing about that, it was the only place that actually had a working scale. So if I had to dose medications for kids, I said, perfect, I have a scale here because I'm not going to rely on your weight from 6 months ago because it's probably not accurate. So that was a blessing to be in this room. But what I love about this picture, this kid's clothes is so big for him. I mean, he must have been about 2 or 3 years old, really cute kid. But I think that just shows just kind of the transitory, the shocking kind of situation that both of us all found ourselves in. So other challenges that we encountered, many families had no records or documentation. A lot of them had vaccine records from back home, and they were relying on WhatsApp to have their family members take pictures and send it to them here. A few of the families actually were in Texas long enough. They came in with these beautiful vaccine records, just pristine. I wish all of them were like that. But our staff quickly learned how the different vaccine schedules were for the different countries. You know, it's not like what the CDC recommends here. They don't give varicella 2 doses like we do here. They give BCG. They sometimes will give oral polio vaccine, not just the injectables. And each country has their own system to what they do. So other challenges that we encountered, we did not have a clear idea of what kind of health screenings these families had before they came. New York City had done limited screenings, but they focused their energy on single adults. So I had to assume pretty much these families coming in pretty much had very little screenings of anything. We had to think about what kind of risk of diseases do I have to think about for my staff? Not only things like TB or anything else when they were walking through the jungles. A few of the kids that we saw had rashes on their bodies. Is this something that is contagious? Now we do see some kids with some abdominal parasitic infections, which in that part of the world is commonplace. That's something I only read about in my residency in med school. And kids were needing to get into schools rapidly, within a week of arrival, and then now they need to get vaccinated. In New York City rules, you have up to 30 days to start your series of vaccines. So it's unrealistic to expect that you're gonna finish like a hepatitis B series or a tetanus series if you have nothing. And unfortunately, even if they have no records, New York City gave us guidance that said you need to treat them as if they're vaccine naive. So a kid who probably got vaccinated, I'm gonna have to start them all over again. That's hard for me to swallow, but okay. That's a lot of needles to think about for this child. Even some of the records that they were coming with, it was unclear, can we use this as valid infection documentation or not? So those are some of the challenges that we were encountering early on. So one of the things that our health center has been a part of in many different occasions throughout the last 15, 20 years is in an emergency preparedness and emergency response. So if any of you all have looked at emergency preparedness response models, this is pretty much the standard one that FEMA promotes. But I wanted to put this wheel up here because in any type of crisis, these are the 4 points of your cycle where you start in the preparedness stage and you think about, okay, what do I need to do in case there is an emergency? Am I prepared for that? Whatever it may be. It could be a hurricane, it could be a flood, it could be power outage, or it could be an infectious disease like COVID or monkeypox, or fill in the blank of the crisis. Then what's my response gonna be? Right? So after you figured out how you're preparing, what's my response going to be? Am I going to have a stabilization unit? Am I going to have a triage system? Like, what's that going to look like with where I'm at? And then in my recovery, after the disaster's over, once my response is over, how am I recovering from that? How are we getting back into a life kind of back to normal? And your mitigation is, what do I do with further prevention? Or maybe this is why I rethink, what did we just go through? Sometimes we call that an after-action report. What went right? What things do we need to consider changing in the future? What do we definitely want to make sure we have ready? And so in the last 15 to 20 years, our center has gone through different crises, whether it's hurricanes or now with COVID, whatever it may be. And so without me realizing it, we were kind of going through the EP response to what happened with our migrant response. So here's some of our initial responses. How am I supposed to get medical care to these families? Am I gonna have them come to us, or do we need to go there? How do I even set up a medical site at the hotel? I don't have an extra exam table sitting in my clinic. How am I supposed to do that? How am I supposed to get diagnostic equipment? How am I supposed to do what we need to do? How am I supposed to get vaccines to this place? And to keep it under, to make them under controlled settings. What are we gonna do there? What's my role? Am I acute care? Am I doing physicals? Am I doing vaccines? How am I staffing this? What about malpractice coverage? And what does my HRSA people have to say as an FQHC? What does the state have to say regarding Article 28? What is DOE saying? What is New York City DOH saying? And what's the CBO saying? What do they need? So we took all these questions, and we developed our first response. So we decided, let's set up a clinic session just for the migrants. And we opened up one of our offices just for them, and we arranged for about 20 patients to come in. We did this one because, again, we have no idea where they're coming from. We don't know what communicable diseases they have. We don't want to do some cross-contamination. Let's just keep it in one place at a separate time. It's just dedicated for them, no other appointments. Well, a couple things we realized right away. We had a huge problem with transportation. Public transportation was not an option. The local CBO had vans, but they found when they were trying to do it, the vans weren't working all the time. And if you're needing to see one kid, there's usually 3 other family members. Well, you can't just bring that one kid. You're bringing all 4. So you're already limiting your van space. Now you're bringing the whole family, okay? And then, interestingly, a number of my staff who themselves are from minority backgrounds, and some of them have actually also had their own stories of being a migrant at one point. They were also giving me some resistance because of what, unfortunately, some of the families were presenting an attitude of just not really being that grateful, being a little entitled, because again, they were expecting something very different. And it was very disappointing for them to see, you know, you have shelter. Yeah, it might be food you're not used to, but you have food, you're not starving. But to hear bickering and complaining was very disappointing for them. So after that, we decided this is not gonna work. If we only got through 15 kids, and there's like another 300 over there, this is definitely not gonna work. So then we said, well, what would it take to go there? And so these are some other things we thought about. Project Hospitality was willing to give us one of their hotel rooms. Yay. It gave us 2 originally, but then they needed rooms because they also were doing some case management work there. We had a lot of interested volunteers who wanted to help, a lot of medical students, residents from New York, New Jersey. But I couldn't get their malpractice and coverage to cover what they did with us. And we had a hard time getting ours to work out too. We still had our regular office hours to run. So I had limited staff available who are also bilingual, getting medications and supplies to patients with no insurance. And the political climate is such where Staten Island, out of the 5 boroughs, is the only one that votes consistently as Republicans. You may have seen in the news in this past year of protests at a few of the planned shelters that the city was trying to do. That's real. They tried to do another protest when the contract came up for renewal this past fall. I think, 7 people showed up to this? I mean, I get it. The community definitely was very upset, but the city actually didn't help themselves either because all the buses that were coming initially were all during darkness and during the night and gave really no warnings, except probably to some of the elected officials. But it just didn't help given the situation. Each borough did get several hotels, shelters set up. So at this time in the fall of 2022, there were somewhere between 30 to 50 hotels throughout the city. So we were at 2 of the ones that the city had. And we're still getting new families arriving, even now, as families are leaving. I wanted to include this as a resource. So on my way to medical school, I had a chance to study in bioethics at Trinity. And my professor, Dr. John Kilner, had written a book back in the 90s called Life on the Line. It's actually a book that's addressing how to care for the aging, but how from a Christian perspective can we make ethical decisions, and particularly in that context. But when I thought about our situation, I really loved his 3 points that I think could also cross-apply. And his 3 points are that whatever we do in our decision making, first, they need to be God-centered. That is still our motivation in all that we do. You know, that's the call that compels us to go where there is no one else there, to go where the need is, right? So first, it's because of God and his calling on us. Secondly, we have to accept the fact that we have a reality that gives us boundaries, whether we like it or not. We will not have limitless resources. There will be a limit to what is available. So we have to recognize that, and then being creative to work with the resources that we can access. And then being love-impelled, this is where we're loving our neighbor. Leviticus 19:34, we're loving and welcoming the stranger, as the Lord is commanding us and showing us that we were strangers once when we were in the land of Egypt. And so what does this mean? That we're providing a safe place for the migrant families, especially in places where they know that the neighborhood people may not want them there. So what does this look like? I'm gonna go a little bit faster here. So I told you they gave us 1 hotel room. Amazing what you can find on Amazon, because I had no exam table. So that is a $99 massage table. Early on, it must have been really comfortable, because there was a kid that I was doing an exam on. He fell asleep on that exam table. Extremely sturdy. It doesn't look it, but extremely sturdy. That scale came from the fitness center, so praise God, we have that provision. And we brought in our diagnostic equipment, because at that time, we didn't feel comfortable leaving anything that was of value. And they set up chairs in the hallway for us in our little one-room clinic. And basically, we were able to do what we did. And what I love about this picture is not only are we able to do medical assessments, but sometimes we'll just simply say, ¿Qué pasó? How are you? And then that's usually either where the tears fall, or they start to open up to us about what they've been through. They tell us a little bit about their journey. And then we have a chance to pray for them and ask them, are you interested in being connected to a church? Have you been connected to a church? There's several here nearby. One of the things that we found out was that no other church-based religious groups have been allowed access here. And so for us to be able to have, in the privacy, talking with the patients, to be able to then say, we're going to bring God into this too, was really amazing. And sometimes just to pray for them, I mean, so many times, they're just so grateful for that, with what we were doing. So with our impact since we started back in October of 2022, we've now seen over 700 lives at the hotel clinic. We still have them coming to our main offices too. Now this is only doing 2 afternoons a week. And if you remember earlier on that we were only working in 4-hour shifts, and that was a deliberate move from the very beginning. This kind of work is emotionally draining. And I'm sure for anybody that works with refugees, you can tell me, like, it is hard. And for the sake of protecting our most valuable resource, which was my staff, we said, if it was up to us, we would just stay there 24/7, but we can't. So we need to put a limit and protect ourselves. We're only doing 4-hour shifts. That's not because we don't want to do more, it's because we need to save ourselves. We need to make sure that we can make this work as long as we possibly can. So we did add some more sessions where we did just vaccination, where we did 3 to 4 hour vaccination events, where we were doing flu or COVID or the routine vaccines. Everything from chickenpox, MMR, polio, Hep B, DTaP, meningitis, whatever they needed to get into school, that's what we had in our cooler. We also did open up for some of the women who were found to be pregnant when they arrived or were pregnant when they arrived. So we had about 4 women that we took care of. We also have a local hospital that also helped out as well. We did find 2 women who were HIV positive, didn't know it when they got here. And that's been another amazing ministry, because in Venezuela, if you have HIV, you may as well just know you're going to die. And to see that they're living and thriving, and they see that they can live and thrive and they're not going to die, it's transforming for them. Our mental health support, Project Hospitality does offer some mental health support there. We also do have a bilingual speaking counselor on our staff, and a few of the patients have been able to see her, but one of the really cool things that she was able to do is link some of the high school kids together that were living in the same buildings but didn't know each other. So one time she did a group session because she knew that she saw a few kids and said, hey, you go to this high school, this one, she's about to go to that high school. Do you not know each other? Got them on a Zoom call. And they both all just relaxed, saying, this is cool. I know somebody. I'm not walking into this completely like shell-shocked and wondering how I'm going to make it work. So that was a really neat thing that we were able to do, is just connect those people together. And really, like I said before, providing prayer in that place to talk, connecting people to churches if they so wish, but continuing to be that resource. So this is a lot, I know. I asked the medical team, we have a team now that works at the hotel. And Christopher Giron is our nurse practitioner who just started last year in May. It's a lot there that he wrote, but one thing that I loved that he picked out was that the fact that the hotel was like a sanctuary, where whatever journey that they went to, whatever that they did, that we're able to be there to provide that peace that comes when you're in that in a place like a sanctuary. But what I really wanted to highlight was his quotes on the blue that are written in blue, and this is from one of the kids that he had seen. That when he spoke words of encouragement to a young girl struggling with school-related challenges, battling feelings of depression and alienation, following our conversation, she expressed a newfound aspiration to follow in our footsteps and provide medical assistance to those in need. So I don't know what this girl was thinking before she came in, but as a result of the conversations that this team was able to have, now here's a girl who's now really thinking, hey, maybe I can go do what you guys are doing, which is amazing. Now this slide, it's, if you can see, and for those who read Spanish, you guys can understand what's on the right. But the one on the left, I love this one because it's a picture of a nice slender woman there, and this is actually Luisa. And what's touching about that letter is this is a girl who's been there for about a year. This is her first letter that she wrote in English after coming here. And she basically said, for those on the recording, thank you for the attention and care that you have given me and my parents, Dr. Luisa. It is nice to feel that we are not alone and that thanks to your help, we find solutions to each problem encountered. I thank you enormously because you were one of the few people who she helped us when we arrived. I loved her very much and I will never forget her. Thank you for everything. We love you very much. And I think the first thing Luisa said was, wow, you gave me a waist, you know? I mean, Luisa's beautiful, but that's what she loved. And then this one on the right, again, my Spanish is terrible, but this is one of the notes that one of our migrant patients had given. She was one of our patients that we gave a bad diagnosis to. And she wrote a lovely note to Luisa as well as to myself of just the impact that we've had. So a few takeaways that I wanted to kind of talk about. The pictures on the right is one of the outreach events we had with one of our local churches, where we had people who were able to pray with patients. You can see one of the pictures here that there's a crowd surrounding somebody that they were offering prayer. We were giving away some vitamins to adults and kids, and when I tell you that there's no medical care given at the shelters, we love our Project Hospitality team members. I'm incredibly grateful for the leadership of Project Hospitality, but when they say that they do not do anything medical, they really don't do anything medical, including even giving a Band-Aid. So when we did an outreach, we got a lot of donated Band-Aids that went out to these families to make sure that they didn't have to wait for us to be open for them to get something as basic as a pack of Band-Aids. So we got some gummies, vitamin gummies for them. But again, there's not a lot of opportunities to do direct engagement within the shelter community. So to have this opportunity to be able to do this was wonderful. So how would you respond in your community where you are? Identify those specific needs that you see. And it may just be a vaccination event, or it may be a way of meeting some other physical needs that may not have been talked about or even brought up before. In this particular shelters, there's no kitchens, and there's no way that they can cook. And a couple of the local churches have been exploring with us, can we maybe bring some of the women for them to be able to cook in our kitchens? And then we can have some conversations and then bring them back to the hotel. So that's some creative things that we've been talking about with them, because they have this limitation that they can't cook anything in the buildings themselves. Identify your resources. Just because you have a doctor or a nurse practitioner or a PA or a nurse on your staff doesn't mean they're cut out to do this. And when we started this, I was the lead clinician on staff that was there. My husband, also a physician, came a couple of times. I had some nurse practitioners that came. And then I tried to make a consistent provider for a little while. She's a great clinician, but it just wasn't the right place for her. It was a little too rustic, simple. The structure just didn't fit for her. So when Christopher came along, he did great. He's flourished. The patients love him there. The staff love him there. It's worked out great. So something to think about is just because you're a clinician and you have a heart to serve God in a needy place doesn't necessarily mean that they will always be a right fit for you, and that's okay. And I will have to say that one of the reasons why I think we've been so successful to be able to maintain this presence as long as we have, it goes back to relationships. Out of all the boroughs in New York City, I think Staten Island, we're an island, right? So about 400,000 people. You pretty much almost know everybody. Like everybody just kind of knows everybody. The different agencies, they all know one another. I also have been blessed with relationships high up within the Department of Health. A good friend of mine works in the Bureau of Immunization, so when I needed extra vaccines just for the migrants, she fast-tracked me to get stuff that I never thought I could. We developed a rapport with the Department of Education school nurse liaison, who oversees all of the school nurses in Staten Island. We were able to get those relationships, and I think that's where we've just continued to get favor. And so wherever you are, think about, even if the agencies or government officials, they may not necessarily be the political party that you might feel comfortable with, when it comes to stuff like this, it doesn't matter. Their job there is to still represent and take care of the needs of the community. And we've had more relationships with people across the political aisle in the last 20 years of what we've done. And it's not just work-wise, it's also as personal relationships. It's been really amazing. And then looking at the role of the church, connecting our migrants to faith communities. And would love to know how to pray for you. I'm going to leave up here our slide of prayer requests for us. My contact information is here. My business cards are here. So thank you very much. Thank you for hearing our story.